I'm Dr. Raghavendra. I'm consultant in Department of ENT in Narayana Health City. I have a special interest in surgical management of snoring and sleep apnea disorders. So, what is sleep apnea, or we call it as commonly obstructive sleep apnea? So, obstructive sleep apnea, which falls into a category of sleep-related breathing disorder, in which patient experiences or a person experiences excessive snoring during the night. So why this snoring happens basically? The main reason for snoring is there is obstruction of the upper airway during the sleep. So there are a variety of symptoms in the patient presents to our in OPD. So these symptoms can be categorized into daytime symptoms as well as night symptoms. So the common daytime symptoms what we see is excessive daytime sleepiness, daytime fatigue, morning headache, unrefreshed sleep in the morning, and reduced work performance. Night symptoms can be categorized into nocturnal enuresis, choking spells at night, breath holding spells at night. So these are the common symptoms which we see. There are other very vague symptoms which can present with the sleep apnea. So these are the symptoms are uncontrolled hypertension, in which patient requires more than 1 or 2 medications for the control of hypertension. The other symptoms are reduced libido or reduced sexual activity, and many a times patient also presents with uncontrolled migraine which is not respond to the conventional treatment. So there are variety of symptoms a person can present as OSA. So how do we treat this OSA? So before treating, OSA requires specialized or exclusive evaluation, which is extremely important for a proper treatment. So we have a set of, initially in the diagnosis, we have a set of questionnaires. There are many questionnaires which are there. Secondly, the evaluation comprises of multi-department approach. So it requires a thorough questionnaire, as I already mentioned. Second is proper fiber optic endoscopic evaluation and X-ray cephalometry, which tells about the bony architecture and etc. So having done all these, the treatment aspect depends on what is the level of obstruction which is there. So which could be a surgical treatment or which could be a medical line of treatment. So in a surgical treatment, there are various varieties of surgeries like palatoplasties, maxillomandibular advancement and nasal surgeries, etc. So why the sleep apnea needs to be diagnosed? The reason behind is it leads to many risk factors like development of hypertension, development of diabetes, risk of stroke, risk of cardiac diseases, risk of many pulmonary problems, etc. So this requires a proper evaluation and treatment. Snoring is not a good sleep, it's a bad sleep. Please get it evaluated.